Are you wondering what kind of supplements that you should be taking to treat your hormone imbalance? Let's dive into this and unpack this, because there's actually a lot going on this inquiry, and I want to acknowledge your intuition. I'm so happy that it has landed you here. My name is Dr. Chelsea Dakers. I'm a naturopathic doctor, and my area of clinical focus is fertility, menstrual, hormonal, or pelvic. So let's get into it. So you might be experiencing mood swings, maybe fatigue, maybe all through your cycle or just parts of your cycle, and you're experiencing irregular menses. So maybe you're not bleeding at the same time every month. The amount of time between bleeds is different, and maybe the number of days that you're bleeding is also changing. So let's see what we can unpack when we think about root causes. I like to think about the daily routines. The way that you live your life creates the conditions for your hormone function. So if you are in this super grind lifestyle and you have a real intensity to your life and you're indoors all day, that is pretty stressful. So when we're in that survival physiology, we're kind of in that fight, flight, freeze state. That is actually not the state that we want to be in for optimal hormone function. Why is that? Because you're going to be kind of in this cortisol dominant pathway, and that's one of the main hormones that is responsible for that stress physiology. And it's interesting because being in those artificial light environments indoors all day, for example, not getting a lot of sun exposure is actually really stressful. And so you have this interesting play between cortisol, which is kind of your daytime hormone, it's your waking hormone, and it's in tension with melatonin. You might have heard about this one. Melatonin is the hormone that helps you fall asleep at night. And these two are our anchors for our hormone system. So yes, we can talk about estrogen, progesterone, insulin, etc., but thinking about these real anchors to our physiology, we have cortisol and we have melatonin. And cortisol, interestingly, this hormone that is so related to stress physiology, is a light dependent hormone. This might be something you've never heard before. So the natural light in our environments, or the lack thereof, directly impacts our cortisol. And that is also having a profound effect on this relationship between cortisol and melatonin. And so when we're thinking about supplementation for hormones, we want to make sure that we're actually addressing the root cause. Many of the people that I have worked with always feel better when they have started to pay attention to their light environment, artificial light, natural light, and finding ways to get more natural light and less artificial light. There's a whole methodology there to learn how to create that optimal circadian environment for your biology. So maybe you're feeling a bit frustrated. There's been a lot of trial and error for you, and that's really common when people are looking to find the supplements that they should take. They try a lot of things. They hear on the internet maybe they should try something. They spend about a bunch of money. Maybe this is sounding familiar, and you don't really get the long-term benefits. You always have to stay on the product. Maybe it had an impact and that impact has waned. So you're kind of always in this this for that approach, and maybe you're feeling frustrated and maybe a little bit disappointed or disheartened with that whole process. And maybe you're wondering, is this really what supplements and hormones are about? Like, is this how you really heal your hormones? I want to let you know that I created a framework for you to learn how to create the conditions for your hormones to heal naturally. If this sounds like something that you want to learn about, please join the waitlist for my next cohort.